When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Sarah Day here in for Elias Makos this morning. Well, yes, the budget was tabled yesterday and there's a lot to talk about, but we're going to focus on one thing in particular, mental health funding. There was a slight increase in overall funding for this sector, but well below what was being called for. Now, how does Quebec rank against other provinces when it comes to mental health care and support? Glenn Brimacombe is Chair of Public Affairs Committee of the Canadian Alliance on Mental Illness and Mental Health. They've rated all the provinces and how they do when it comes to responding to their citizens' needs. Glenn joins me on the phone. Good morning.
Good morning.
So, how did we do? How does Quebec, what is our score, first of all, and how do we measure up against the other parts of the Confederation?
Well, the question was asking Canadians across the country, how do the provinces rate when it comes to the ability of the residents to access a mental health professional? So the answer and grade for Quebec was a D. What's interesting is 6 of the provinces rated a D, 3 provinces rated an F. Overall, 47% of Canadians provided an F grade. So in a sense, you're keeping company with the other provinces, but clearly there's room for improvement in terms of improving access.
Okay, needs for improvement, but we're doing better than other people? Okay, so when we talk about mental health care access, what does that mean in particular? Does that just mean, oh, I have a bit of anxiety and I'd like to speak with someone? Or are we talking more dire cases where someone needs like an intervention and perhaps needs a greater amount of help?
It's all of the above, quite frankly. It can be from mild to moderate anxiety, depression, where you'd like to see your family doctor, all the way to issues around that are more severe, for example, like schizophrenia, where you'd want to access a psychiatrist. So there's a broad spectrum and array and combination of mental health disorders or problems to which Canadians or Quebecers want to access their mental health professionals. And one of the challenges in our publicly funded system is that the portal for entry is very narrow. So what I mean by that is, if you don't have a family doctor, there's difficulties in terms of extended wait times getting to a psychiatrist. You're not in a hospital accessing a salaried psychologist or a social worker. It's very difficult to get into the public side of the system. And this is where, for the most part, in Canada, when it comes to the delivery and provision of mental health care services, it is either through out-of-pocket, you're paying out-of-pocket, or it's through your extended benefits that are provided by your employer.
I can't even imagine what it would have been like for me. I see someone privately and my insurance covers a good chunk of it, but I can't even imagine how long it would have taken for me to, I've been seeing them for a couple of years now. And it's a relatively low stakes issue. Like I basically have anxiety day to day. But I feel like I'd still be waiting. This is an anecdote, obviously, but I feel like I'd still be waiting to see someone. When we talk about obstacles, like what are people in your survey, what were people speaking to specifically? Is it long wait times or just not being able to know where to go?
No, that's a very good question. So it's a bit of a combination of both. 91% of survey respondents felt that they should not have to wait longer than a month to be treated. And right now, we have uneven data when it comes to wait times across the provinces. But I'll give you just one example from another survey said that to access a psychiatrist is 7 months in terms of waiting. I know in Ottawa, where we're based, getting access to a child psychiatrist is significantly long. So it really depends, but the issue of access is the key. So it's current wait times, and the issue is we don't have enough mental health professionals within the public system to reduce wait times and increase access. And saying that, the provinces to some degree are moving. They're responding to some of the needs in terms of looking at different publicly funded delivery models to try and improve access. So, for example, in Quebec, there's additional funding that has been provided by the Quebec government to include psychologists to work in a more integrated fashion with family doctors. So that's a good thing in terms of improving access. But there's clearly, again, there's room to grow and room to accelerate not only the funding that's going into the mental health system. Right now, nationally, we invest about 7% of our provincial health budgets into mental health. What we think is appropriate and more aligned with other G7 countries is 12% of provincial health budgets should be invested in mental health. So more resources is about not only growing the mental health workforce in terms of psychologists and social workers and mental health nurses, it's also about expanding and looking at innovative delivery models that include them.
Did we lose Glenn there?
No, I'm right here.
Oh, you're right there. Okay, sorry about that. I thought you had cut out. I'm speaking with Glenn Brimacombe from the Canadian Alliance on Mental Illness and Mental Health, grading the mental health support systems in each province. Do we need to also, you're talking about greater resources, hiring more staff. I think those are pretty clear solutions. Should we also be still focusing on comparing the provinces, like as a benchmark? Okay, so if Quebec got a D, but Ontario got an F, we know that we have to pick up ourselves by our bootstraps.
Yeah, I think that's an important point to make as well. And that's one of the discussions that the federal government has been having recently with the provinces and territories about we need more standardized comparable data and mental health indicators. And to some degree, we've been building that, and Quebec has been participating, which is terrific. And it's an opportunity for the provinces, in a sense, to learn from each other, because there are innovations in different parts of the country that don't always emerge within Quebec or pick your other province. And they do watch each other, and the provinces talk quite a bit amongst themselves about what are they doing in particular areas to improve access to care, to improve health outcomes. So there are opportunities here through the sharing of data to more effectively measure, monitor, and manage the system.
Glenn, thank you for shedding some light on this issue. I appreciate it.
Thank you for having me.
Glenn Brimacombe of the Canadian Alliance on Mental Illness and Mental Health. Quebec ranks as a D when it comes to mental health access, which is better than the average, but of course not so great that on average we're ranking an F coast to coast to coast.